So I did my service learning project on narcotics, specifically prescription opioid addiction or dependence. I got most of my information from the National Institute on Drug Addiction, which basically stated that most patients are either uninformed or misinformed about the dangers and the risks associated with taking these medications. As a physical therapy technician and working at a pharmacy, I get to see chronic pain patients and post-surgical pain patients on pretty much a daily basis. A lot of these patients are on painkillers like Percocet, Vicodin, even Tramadol, which is a Schedule 4, but still classified as a narcotic. And most of them don't even know that they are at risk for dependence or addiction. So addiction to opioids can lead to other drugs. Heroin actually binds to the same receptors in the brain as opioids, so it is very pertinent that these people get the information necessary to keep them from becoming addicted to these drugs. So I did make a pamphlet for my service learning project. Most of it was discussion based, so it was a very short pamphlet, but it did have some good information in it. Just what you need to know about painkillers. I have some examples of narcotics on the back, and then I've got some information about symptoms of withdrawal, and then the inside of it, which is my main point for this whole project, is that they need to talk to their doctor about the risks. I did make it known that I was not a physician during my service learning project and that they should consult a professional if they have any questions regarding their prescription opioid use and management of pain. So that was the first method that I would have chosen to use and did use for my service learning project. Another potential method would just be a more in-depth prescriber information session. I've seen proposals for classes after you're prescribed a painkiller. I really just think that doctors need to let their patients know what they're up against when they are prescribed prescription painkillers, really explore different options for pain management, things like that. Especially with genetic testing, they can know if a patient is more predisposed to addiction before they are even given the drug. So that should be utilized, as well as a family history of addiction, just really taking the time to go in depth with their patients and figuring out what's best for them. And then the last method would just cover all of the bases. When the patient picks up the prescription from the pharmacy, the pharmacist should go more in depth as well. Most counseling sessions only require that they give them the side effects of the drugs that they're picking up and not necessarily the potential for dependence or addiction. So if they knew about those things before they got the drugs, they could be contacting their doctor for something not as strong, really evaluating how they're taking the medication, just being conscious and aware of the dangers associated with it. So my service learning project mainly took place at the physical therapy office where I worked, and a little bit at the pharmacy. It was mostly discussion-based, especially at the PT office, because I spend at least an hour with those patients. I'm allowed to ask them questions about their pain. They normally offer up information about the last time that they took their pain pills, so that just opens up discussion for my service learning project. I got to interact with a lot of patients. My target audience was really any patient who was dealing with either chronic pain or post-surgical pain at the physical therapy office. Most patients were older. Most of them suffered from post-surgical pain. Only a couple had chronic pain and were on things like morphine, so that was a smaller population. But that was really my target audience, and I got to interact with a lot of people there. I helped patients get more information about these things. I did have one example where a patient was supposed to be intermittently taking ibuprofen between her doses of Percocet, and she opted for Tylenol. So I, though it wasn't a danger of narcotic addiction, She was at risk for acetaminophen overdose, so I did get to tell her to talk to her doctor about her methods of pain management, and that was beneficial. She did tell me that she was supposed to be taking ibuprofen. She had just run out and chosen Tylenol, but by informing her, she had actually gone back to take the ibuprofen, so that was beneficial. It really overall opened my eyes to the dangers of narcotic addiction, the steps that need to be taken to prevent dependence. I really liked engaging with my patients in this way, and just interacting with them. It was really a good experience, and it was very light, and I liked that it was discussion-based. I would have liked to leave the pamphlets on the counter, but corporate would not let me do that. So in the future, I would rather set up a table somewhere where I can inform patients about the risks of painkillers and things like that. And then there were some barriers at the pharmacy that were in place, which is why I did most of my work at the physical therapy office. As a pharmacy technician, I'm technically not allowed to counsel patients. That's what the pharmacist is there to do. So I really didn't get to have any conversations there. But overall, it was a really good project. I look forward to continuing this work in the future at the physical therapy office, letting the conversation go on with the patients that I've interacted with so far. And I would just suggest that the effort keeps moving forward.